Hello students, in this video you are going to learn about sexually transmitted diseases, their meaning, causes, symptoms, mode of infection and prevention. Please like, subscribe and share my videos. Sexually transmitted disease. Let's see what is the meaning or definition of sexually transmitted disease. The term sexually transmitted disease or STD is an infection or disease passed from one person to another through sexual contact. One can have an STD by having unprotected vaginal, anal, or oral sex with someone having STD or venereal disease. An STD is also called as sexually transmitted infection or STI or venereal disease. Usually STDs are caused by microorganisms like bacteria, viruses, fungi and protozoa. There are many types of STDs. The most common STDs are syphilis, gonorrhea, HIV, chlamydia, pubic lice and genital herpes. Transmission of STDs or mode of infection. Let us see how STDs are spread. STDs are passed on from one person to another through sexual contact with an infected person. It doesn't mean sex is the only way STDs are transmitted. It is also transmitted or spread through blood to blood contact with an infected person, from an infected mother to her child during pregnancy or during birth or breastfeeding. So it can pass from infected mother to baby. Then direct contacts with open sores. If the person is having lesions or sores, if another person come in contact with those lesions or open sores, he may also get the infection. Also sharing personal things like towels, shaving kit and other things with an infected person. Symptoms of STDs in men and women. Let us see the general or most important symptoms of STDs found in men and women. It is possible to contract an STD without developing symptoms. Means a person after having infection, he may not develop symptoms, or after some time he may develop the symptoms. But some STDs cause obvious symptoms such as pain, discomfort, or burning sensation during sex or urination. Sores, bumps, or rashes on or around the penis, vagina, testicles, anus, buttocks, thighs, or mouth. Unusual discharge, itchiness, or bleeding from the penis or vagina. Symptoms can vary depending on the STD. So these are the general symptoms we are studying here. Other symptoms or the symptoms may vary from one STD to other. Prevention and control. Let us see some important measures or steps to prevent and control the STDs, like education and counseling to reduce the risk of STD acquisition. Promiscuity should be avoided. Promiscuity means having more than one sex partner. One should have one safe and trusted sex partner. Sex with a single partner is the best method. Homosexuality and rectal sex should be avoided. Use of condom during sexual intercourse is important. Washing before and after sexual intercourse is advised. Detection of asymptomatic and symptomatic infected persons. If a effective diagnosis and treatment is needed. Pregnant women should be tested and treated for potential STDs so to avoid the transmission of disease into the babies. Safe blood transfusion is another important step to prevent and control STDs.